I want to talk today about why it's important to have someone advocate for and navigate the healthcare system for an aging loved one. I had a client back in 2021, so still kind of during that COVID period. We still had a lot of COVID going on. She was an older client in her mid to late 80s. She had a great family, I believe 5 children, very involved with their mom and her health. But like most of us, they were busy. Mom's health was starting to decline, and she was starting to see a lot more doctors and have more health issues. And they always had someone that could go to the appointments with her, but they were really looking for someone to kind of help manage that care and to be able to attend all of the appointments and keep the whole family up to date as to what was going on. So I'd been working with her for a while. I had started attending appointments with her. We saw cardiology, we saw pulmonology, we saw her primary care doctor. And after one particular primary care doctor, it was about 2 days later, I got notice from her and the family that she wasn't breathing well. She was having some trouble breathing, and that a neighbor had came over to the house who happened to be a respiratory therapist and told her that she really needed to go to the hospital. So they called an ambulance to take her to the hospital. Well, remember, this is during COVID, and the hospital that was close to her house that she always went to was on bypass. So the ambulance had to reroute and take her to another hospital. Now, the hospital that they went to is a great hospital. It's part of a great system. There was nothing wrong with the care that she was going to receive there. But here is an 80-plus-year-old woman with an extensive health history that shows up in the ER with no medical records and is short of breath. So they got her in, they did all the testing, they got her stabilized, they admitted her, and the cardiac team comes in and says, "You've got a bad aortic valve, we think it needs to be replaced." Because she was working with an advocate and I had been attending all of her appointments, I knew that her cardiologist was aware of the valve issue. I also knew that he had recently done an echocardiogram. They had made the decision together that they were going to hold off on replacing that valve. I also knew she had just seen the primary care doctor a couple of days ago, and he had changed a prescription that could affect her breathing. Because I was able to piece together all of the pieces to the puzzle, they were able to adjust her medications, send her home stabilized, and she followed up with cardiology and actually never even ended up getting the valve replaced. This is why it's so important, especially for our aging population, that they have someone that is willing, able, and capable of advocating for them and helping them navigate the healthcare system. In this instance, it saved an 80-year-old woman from having a heart surgery. If you want to learn more about how to navigate the healthcare system or how to advocate for you or a loved one, follow along. If you've got questions or concerns about our healthcare system, drop us a comment.